So hello and welcome you all to Sail to MDS Dental Academy. Myself Dr. Malaithri, I am pediatric dentist and assistant professor in College of Dental Sciences. So dear friend, the topic of today's discussion is the novel coronavirus. I am going to use the word COVID-19 which is suitable for that. So friend, the main reason for uploading this video is that there are many myths among healthcare professional, among people, which is creating havoc. So just want to tell few myths in the beginning that some people are telling me, few of my healthcare professional, my dental surgeon friend are telling me, few of my doctor friends are telling me that when the climate will become hot, the corona virus or the COVID-19 will die. So there are a lot of wrong myths are there. So for that I am presenting the video. And second, being a dental healthcare professional, we should know what all precaution we should take, what all we should tell to our friends, our family members and to our patients, and if at all patient comes, how to screen it, that whether we have to go for the treatment or not. Before starting the video, I want to tell that whatever information I am sharing today is from the World Health Organization update, Osmosis 2020, which is the healthcare website, and from the latest PubMed article. The citation I have given at the end of the video. And for the research of the article, two of my friends have helped me, that is Dr. Amit Boliwal, he is a consultant endodontist, and Dr. Khushbu Modi. So friends, let's get started with the video. It is in animated form. I hope everybody will like it. So friend, before starting the video, we should know little history. So when we tell to anybody, we should not just tell it. We should substantiate our fact with the base. So as we know, in December 2019 in China, the cluster of pneumonia cases were there. On investigation, it was found to be some affected with the unknown virus, which is now known as 2019 novel coronavirus. So how the structure is there? It is the RNA virus. It consists of the genetic material in between, have envelope and the protein spikes. It looks like crown on ram, that's why the word corona has been given. Remember, this coronavirus are a large group of varieties. They are different type, like they can cause a respiratory disease, they can cause a GI infection also. They can cause mild disease like a common cold, pneumonia, and some can cause severe disease like acute respiratory syndrome. This coronavirus is not new. Every time it comes in certain mutated form. We have seen in 2003 in China, there was a SARS, that is the severe acute respiratory syndrome coronavirus. In 2012, there is MERS, that is a MERS, that is a Middle East respiratory syndrome in Saudi Arabia. Now in 2019, we have a novel coronavirus which is also from the China. So this is the little important scientific point regarding this coronavirus. So we should know what all diseases it can cause and what all types of viruses have been there in the past. Now this origin of virus, I want to tell to everybody. Few people are telling that the virus have originated from the bird known as bat. Many people are telling it's a biological weapon. Dear friend, it is wrong. This COVID-19 or coronavirus tend to be present or circulate in many animals. It can be in your camel, it can be in your duck, bat, it can be in any animals. And how it transfer from animal to man, the process known as spillover. And it occurs because of many factors like a close contact of man with the animal. Second, it can occur because of the mutation of the virus. Just want to tell that the SARS in the 2003 was from the civet cat. The MERS in 2012 in Saudi Arabia was from the camel. And this 2019 novel coronavirus has not yet been identified that it is from which animal. So stop circulating this that the novel coronavirus is from biological weapon made by China or from the bat. And I hope everybody has seen this picture that from the New York Times, that the dental surgeons are at the highest risk because we check the oral cavity and there are chances that the cross infection can occur from the patient to the doctor and from the doctor to the patient. So we should take few precautions. Now before that, want to talk about the myths regarding the COVID-19. So many people are telling that coronavirus will not spread in the India because we have hot and humid climates, and also the coronavirus cannot survive the extreme climate like cold climate also. But there is no evidence has been suggested yet that is because no research has been done yet that the coronavirus cannot survive in the extreme hot or extreme cold temperature. And remember, the normal human body temperature remains around 36.5 degree and 37 degrees Celsius, regardless of the external temperature or weather. So the cold weather or hot weather has no effect with the corona. Then one more thing, taking a hot bath does not prevent the new coronavirus disease. Remember, this is also one of the myth. Now, people are telling that the coronavirus can be transmitted through mosquito. No, dear friend, it is transmitted can be through droplet infection. So the new coronavirus cannot be transmitted through mosquito bites. Then remember, the hand dryers are also not effective in killing the 2019 novel coronavirus. Then also, the ultraviolet lamp should not be used to sterilize hands or other area of skin as UV radiation, because it can cause skin irritation. Now, few people are telling that the thermal scanners are effective in detecting the people with the novel coronavirus, but it is wrong. This thermal scanner only detects the people having a fever, and normally the fever develops around 2 to 10 days. It's a normal incubation period of this COVID-19. So dear friends, these are the few myths you should know and you should tell your surrounding people also. Can spraying alcohol or chlorine all over your body kill the new coronavirus? No, it is completely wrong. It is not going to do. Rather, it will be harmful to your mucous membrane of eyes and mouth. Then, vaccine of pneumonia can protect against coronavirus. No, dear friend, it is not going to protect, because many of the doctors are nowadays giving the pneumococcal and Haemophilus influenza type B vaccine that it can protect against novel corona, but no, it is not. The researchers are going for the, or you can say the clinical trials are going for the vaccine of novel coronavirus, and it will take around 2021. This was also one wrong news. I have seen that Donald Trump is carrying something, and yes, vaccine is that. No, vaccine is not yet identified. Now, can regular rinsing your nose with saline help prevent infection with the new coronavirus? This is also wrong. It will not going to help. Even garlic also will not help in killing the coronavirus. And yes, people are telling that coronavirus can affect the older people or very young people. It is wrong. The data is there from the Osmosis 2020. It's correct data that the fatality rate is very minimal in children around 0 to 9 years. It is more in elderly because it is a comorbid condition. The coronavirus occur in a patient who are in already debilitated state, or you can say they have the lower immunity. In that, we can say the cardiovascular disease, hypertension, diabetes, etc. make this patient predisposed to this virus infection. Then antibiotics, there are no antibiotics because antibiotics work against bacteria only and not for viruses. And there are medicine. To date, no medicine has been there to prevent or treat the new coronavirus. So how the transmission is there? The transmission is barely by two things that has also not yet been completely researched out, but it has been said by WHO that the transmission is by the respiratory droplet infection. That's why we have to maintain the distance between the two persons, and as well as also from the surface contamination. So what is the presentation of disease? Mild versus severe. It can cause a normal fever, cough, pneumonia, and in severe cases it can cause breathing difficulty, kidney failure, as well as death. So what are the tests used for the diagnosis of your COVID-19? It's a reverse transcripted polymerase chain reaction. It is also known as genetic finger test. And to rule out whether it is a COVID-19 or any other thing, you can go for the CT of the lung as well as quick flu test. Now treatment, there is no specific treatment. The research is going for the remdesivir on clinical trials, but yet not been used, because this drug is used for the treatment of SARS and MESV. So trials are going that it can be used for the COVID-19, but not yet been confirmed. Treatment, you can go for the supportive care like fluids, oxygen, ventilation support, and remember, there is no vaccine currently available. Clinical trial is going on and it may be available around 2021. So few important prevention points, that's covering your mouth and nose, then avoid close contact with those who are at risk. Professional, healthcare professional, please wear proper mask and your personal protective equipments. go for proper hand washing. People are saying that 20-second hand washing is enough, more than enough. Avoid unnecessary contact with the animals, and if you are eating non-veg, go for the thorough cooking. And if you have any problem like fever, cough, difficulty in breathing, go for the medical care. And another way for prevention is avoid person-to-person transmission. If you have symptoms and you are living with others, try to quarantine in separate room, use separate bathroom, and avoid sharing household items. And remember, animal like dog and cat, they cannot transfer virus to you, but you can transfer virus to them. So please take care. If you are living in an area where there is virus infection is there, please try to be at home, try to self quarantine yourself, have a mask. If you have the symptom or aversion, go for the clinic or talk the clinician. Now this is biggest myth that everybody is wearing mask, and because of that the mask rate has increased, but it is not correct. You have to wear mask only if you have any kind of the symptoms, or if you are there in the close contact with the person having COVID-19. If you are normal, then there is no need to wear the mask, and you should wear the mask in proper manner. Frequent touching of the mask will make your mask infected. So whenever if you want to touch the mask, have a proper cleaning of hand with the alcohol based hand rub or soap and water, and after wearing the mask, properly dispose it. Then avoid person to person transmission. If there is anyone with symptom, please do not attend school, work, person gathering, and avoid travel also. For healthcare worker, especially for the dentist, try to avoid few treatments which I am going to deal at the later, and you can take few precautions like surgical mask, gloves, long sleeved gowns, and eye protection. And there are procedures that produce aerosol like your N95 respirator. For a dental surgeon, it is the ultrasonic irrigation, or you can say the use of the ultrasonics. Now, if you are a dental surgeon, how you have to screen your patient? If dental surgeon is coming to you, you have to go for the initial screening. You can go for the tele-screening also, or initial patient evaluation. Check out the signs and symptoms of COVID-19. Know their travel history and their epidemiological link. If it is negative, you can perform the treatment. If it is positive, you have to think about if it is an elective care, you can defer the treatment for a period of 2 weeks. If urgent care is required, you can go for the pharmacological management like antibiotic analgesic. In case of emergency, you can perform the treatment, but in negative pressure room, or we can say the airborne infection isolation rooms. So please have this screening chart in your mind whenever patient comes to you. This is small declaration screening form for COVID-19 infection. It is from the IDA. You should have this at your clinic. So before treating the patient, try to go with this questionnaire. So these are the references for the current video. You can check out, and stay safe everyone. Please don't follow the myths. Any doubt you have, go for the proper WHO website, read it, everything given, and they are updating at specific time interval also. So please take care all, and see you with the another video.